Okay, so it's the Brad and Jeff show, everybody. And we're joined by Nancy Kazenko. Did I pronounce your last name properly?
You did.
Okay, fantastic. And then, of course, Kathy Shiplett, and Brad Petrella. So, Brad, I've got the slide deck, but you just tell me next slide, and I'll just be behind the scenes.
Go ahead. I'm going to be quick. So start it up, and then you can transfer to them.
Okay.
All right, everybody. Sorry about the little shenanigans this morning. I promised I was on. Anyway, we're really happy to be here. Next slide. So just a quick housekeeping. Questions. Find the question box, not the chat box. Type your questions in there. But I'm going to tell you from the get-go, I heard Nancy and Kathy's presentation last week, and it's fast-paced and it's a lot of information. So we're not going to answer any questions until the end. So then also at that stage, instead of typing, there's a raise your hand button in the control panel. Just raise it and we'll just go around and ask you by unmuting you so you don't have to type in. We don't have to read. How's that sound? Next slide. All right, well, hey, since my camera may not be working, that's me. Some of you know me, some of you don't. I'm the newest addition to this trio of three musketeers. Jeff, who started out, and many of you already know, and Eric Pouncey, he's on our team, and he's really good. He's our tech guru for all things. So maybe it was him who let me in. Next slide. All right, Health Sherpa. I don't think I have to go into this. You all know it. If you're using it, you love it. If you don't know how to use it, let us know and we will help you. Next slide. And really, if you don't know how to use it, we had a really great session 2 weeks ago with the folks at Health Sherpa. And you could always visit our resource center and see that and any other trainings that we've presented so far over the last month or so, or anything before that. So check that out. Next slide. All right, this is where we turn it over to Nancy and Kathy. I'm going to go on mute. Thanks, everyone. Really appreciate you joining.
Great. Good morning, everybody. This is Nancy Kazenko. Welcome to our roadshow. Of course, we're going to be talking about 2024. Hard to believe that's right around the corner. And of course, this is specific to individual coverage. So our theme this year is never go it alone. Again, we take our partnership with our brokers and our general agents very, very seriously. So we want to make sure that you know we're there for you, your staff, and also your clients. Again, this is just a brief overview of what we're going to be recapping today. And of course, as Brad and Jeff mentioned, today's presenters are myself, as well as Kathy Shiplett. And again, Anthem is a national company. A lot of you recognize us as a local carrier, but we bring a lot of value across the spectrum. Of course, Anthem's the Blues plan in 15 states. And of course, we're partnered with our other Blues plans across the country, covering more than 48 million members, or 1 in 8 Americans. Of course, in Ohio, we are the Anthem plan. We've got over 3.2 million members. We are very proud to have been operating in Ohio, covering our members, your neighbors, maybe even yourself, for over 84 years. We've got just under 7,000 employees here in Ohio, again, that represent our brokers, our general agents, and our members. And of course, as diverse as our members are, and even our brokers, we want to make sure that people understand Anthem's associates are just as diverse as the people that we represent. And of course, the theme this year too is how do we make it easier for you, especially going into fourth quarter? We know a lot of you are doing Medicare, you're doing individual, small group, large group. So what can we do to help you? So Broker Launchpad is a very new tool that's been developed. There is a link in the bottom right-hand corner to get quick access to it. It basically is an easy navigation to let you know where to go to get items that you need. So it does a very quick recap of each tool that's available in the broker portal. It's great as a refresher for you. Maybe you've got part-time office staff that you've hired to help you through fourth quarter, or maybe a new member of your staff. Again, it gives them a very complete snapshot of what to go where in the portal. And of course, Producer Toolbox, based on the feedback we get from our broker partners, we're constantly looking for ways to make this tool more and more beneficial for you. We have added a new Medicare snapshot page. Of course, you still have access to the old link that allows you to get into not only individual, but also group. Again, allows you, depending on access, to view commissions, your clients, status of clients. Broker Plus is our mobile tool that we launched a couple of years ago. Again, we know, especially in fourth quarter, you're not sitting in your office waiting for the phone to ring. You're out on the road, you're in customers' offices. So that doesn't mean that you don't want to check and see the status of an application or where an enrollment's at. With the Broker Plus tool, you're able to view all of that from the road. So if you don't have the Broker Plus tool downloaded, you can do that either by going to Google Play or downloading that app from the Apple App Store. And of course, Broker Hub, we launched this last year. It is a one-stop shop. You don't need to be logged in. You just go to anthembrokerhub.com, and it's got everything you need to market our products, from individual, small group, or large group. It even allows you, especially if you're representing us in multiple states, to select Ohio, Indiana, Kentucky, Missouri, whatever state you are conducting business and whatever type of business that is. So you've got access to applications, marketing tools, product guides, certainly Medicaid renewal information, which Kathy will go over toward the end of the slide. Everything that makes it easy for you to be able to sell Anthem. The other beneficial item that's in the Broker Hub is actually taped trainings on how to quote individual, how to enroll individual. Again, part of that quote to enroll includes the presentation on Health Sherpa. If you're new to Broker Toolbox, again, there's a nice video walkthrough that rounds out everything that's available in the toolbox for you to view. So moving into open enrollment, of course, individual open enrollment begins November 1st and ends January 15th. So any enrollments received by a carrier from November 1 through December 15th will have coverage effective January 1. Any enrollments that are received from December 16th through January 15th have a February 1 effective date. Any enrollments received outside of open enrollment need to have an SEP or a special enrollment period. So maybe that's marriage, divorce, birth of a child. You've moved outside of the service area that you currently reside in. You need to have a life change event occur in order to buy an individual policy outside of open enrollment. Of course, all of our individual plans includes a robust prescription plan. More importantly, members have access to Sydney, which is our health app that's available 365 days a year, 24 hours a day, 7 days a week. Of course, we know dental and vision coverage is very important to members, not just pediatric members, but also adults. So we've made a couple changes to that, adding 2 plans for adult dental and vision that are embedded. And then, of course, as we're all very aware, mental health continues to be in the front lines with a lot of people really needing that type of care, whether it's adolescents not being able to understand what's happening in the world, or adults trying to manage through maybe the loss of a job or loss of income to what they're accustomed to. So again, mental health services are something that we have a very robust plan on as well. So a change that we want to make you aware of, so this is not an Anthem change, this is a change that was initiated by CMS. So it applies to every carrier that is operating in FFM exchange states, of course, which Ohio is one of those. So it doesn't apply to state-based exchanges. So what CMS has decided they are going to do is they are going to re-enroll members from a bronze plan into a silver plan if that particular member is eligible for cost share reductions and are currently enrolled in a bronze level plan and would otherwise automatically re-enroll in that bronze plan. The silver plan needs to be with the same carrier and have access to the same provider network that the bronze plan that they are currently in, they would have access to that in 2024. And that silver plan needs to have a premium after subsidy has been applied that is lower or equivalent to the premium of the bronze plan that they would have been re-enrolled in. If all of those stars line up, let's say, CMS is going to automatically send the feed to the carriers, moving those people from bronze to that particular silver plan. The little hitch with that is because our renewals for our ACA members will be going out in the next not quite 2 weeks, the renewal information that will go out on our renewals is going to tell John Doe that he is in a bronze plan and he's being renewed to a bronze plan. Based on when CMS sends that data to the carriers, again, we won't know until that feed comes at the end of December that John Doe and anybody else is being moved. So anyone that's being moved from bronze to silver, you will be able to see that in the broker portal, and the member will also be able to see the change in the member portal sometime after January 5th when that feed comes over from CMS.
Hey, Nancy,
Now,
this is Jeff. I'm
yeah.
sorry to jump in here. And I can understand this is going to cause maybe some questions and concerns from the clients. Will the clients be getting something from the marketplace, do you think?
So
Notifying them
again,
that they're getting
CMS is supposed to have special communications go out to those bronze enrollees that are being auto-enrolled into silver. Unfortunately, we're not privy to know exactly what that's going to look like yet. But CMS is supposed to be contacting them regarding the change. And again, this is brand new for 2024. They have not done this previously. So this is going to be a learning event for all of us, and not just Anthem. This is every carrier that is offering plans on the marketplace.
Okay.
So
Thanks.
again, we just wanted to make you aware. Again, we're trying to make sure we don't get 10,000 calls on January 6th trying to figure out why John Doe was not renewed to his bronze plan.
Thanks.
So what our renewal letter, there's going to be a little disclaimer. So if you can see in the red box, we are notifying them as best we can because we don't know which members or how many members are really going to fit all three criteria. So we are letting them know that if they qualify for extra savings to help lower their costs in 2024, the marketplace may actually enroll them in a silver plan. If they want to keep the plan that they've got, they need to enroll in that plan by December 15th. And again, more information to come as we get details on how that's going to occur. So marketing materials, good news is all of the marketing materials are on Broker Hub for our individual products. Those were posted on October 1st, which was Sunday. That includes medical product guides, both on and off exchange, our benefit booklets, our specialty product brochures for our dental and our vision products, either embedded or standalone. Of course, our state network maps, and also our HSA flyers. So 2024 renewals for ACA specific on and off exchange are going to be mailed right around October 18th to members. In late October, brokers will be able to log into the producer toolbox, select book of business, select renewals, and just like in previous years, you will actually see not a letter like you can download for group, but it gives you member's name. So John Doe's unique member ID, what his 2023 plan name is, the premium for that plan, the renewal plan for 2024, and also the renewal premium. So you'll know everything that you need to have for those individual members by what you can download and print off from the producer portal. Just like in previous years, any subscribers or spouses who are on catastrophic plans that have already turned 30 or will be 30 by December 31st, we can no longer renew them in that catastrophic plan. That's for 30 or under. So they will be transitioned, as you will see in the renewal notification, to a bronze plan. Any spouses turning 30 where the member themselves is under 30, the spouse will be terminated and will get a cancellation notice. We can't automatically migrate a spouse to a new plan. We can only do that for members or spouses when they're both 30. So you may have opportunities, again, for spouses that are aging off, I'm going to say, on a catastrophic plan to set them up on their own marketplace plan. Any members that have dental and vision, whether it's combined with medical or standalone, will receive renewals for all active products with us. They're not going to receive multiple renewals. And of course, if they want to change the plan to something other than what they were renewed to, of course, we highly recommend doing that through the Enhanced Direct Enrollment or ED technology.
Hey,
of course, they
Nancy.
can, yes.
Excuse me, it's Brad. So somebody commented that the sound is not great. Are you on a headset or are you just talking into your
No,
computer?
I'm not.
Okay. Gary, try in the lower right-hand corner of your monitor screen, maybe upping the volume will help hear better. So carry on, Nancy. Oh, you know what? While we're here on the last two slides, Jennifer actually asked a great question, and she asked is, if we renew in a silver plan during open enrollment, how will this affect CMS's changes? Like if the broker gets
silver to silver won't be impacted. It's bronze to silver where there can be a premium savings is what they're looking for to reduce the members out of pocket costs.
Right. I think she was really saying if I put them in a silver plan myself, will CMS's changes undo what I did as their broker?
Well, I'm gonna guess it won't, because
Okay.
ultimately they're getting moved to a silver plan. But since this is new for everyone, I guess we will
Yeah,
all
no,
learn
good
that at the
question, and
same
it's just
time.
really good point to watch out for. So carry on. I think that
And
answers it.
again,
Great.
I would, if you're moving someone from bronze to silver, I would try to do that earlier in open enrollment. So CMS and FFM clearly sees that as they start managing through those renewals in the hopes that they're not going to go in and try to do their own thing, I guess. I just think earlier those changes are submitted, probably the better.
Yeah, that makes sense.
And of course, members, again, on exchange members can log into myanthemchoices.com, certainly to view their 2024 plan options and rates, and to update any personal information that they need to without having to go to healthcare.gov. Grandmothered and grandfathered renewals, those letters will drop around 10/27, so approximately 10 days after the ACA renewals are released. Again, information will be loaded to broker portal, very similar. Again, once you download your book of business, you'll be able to see your grandmothered and grandfathered renewals with the same information: current plan, current rate, renewal plan, renewal rate in the producer toolbox. So our portfolio updates for 2024, again, we're proud to continue to offer plans through all 88 counties. Members can save through Tier 1 pharmacy. We're actually reducing the mail order copay from 3 times down to 2.5 times, again, in order to provide members with lower cost out-of-pockets. We will continue to offer $0 premiums for preventive and virtual care visits on many of our plans. And don't forget, we've got many commonly used drugs that are on our $0 copay list. Just as a reminder, if you're doing Medicare, the individual $0 copay drug list is not identical to what the $0 drug list is for Medicare. It is different. And then, of course, we got a lot of great feedback from members in regard to our smart rewards. So we're actually increasing that incentive from 25 to 45 for 2024. So more great news there. Of course, we'll continue to use our select drug list. That's the same list that we've been using since ACA started in 2014, 10 years. Can you believe it? Again, it isn't a closed formulary, but it does include drugs in every class and category across the prescription spectrum. It does leverage lower cost generic options in lieu of brand name options. But the best part about the select drug list is if a member's doctor determines that another option is not appropriate, maybe John Doe is allergic to a particular drug because it's got a wheat-based filler, and he's got a terrible reaction to it as a result. It needs to take a different medication because it is a soy-based filler. Those are things that we can be very flexible on when it comes to the select drug list. What is not flexible is John's just been on this drug for 10 years and I don't want to change that. There needs to be an underlying medical reason why John needs to remain on that drug. Of course, for mail order, this is also no change. So we use opt-out home delivery. So members can receive prescriptions at their retail pharmacy for the first 2 retail fills. Before they fill the 3rd drug, they need to opt out, either by calling the pharmacy number on the back of their ID card, making the election at anthem.com, or through use of their Sydney app to continue to be able to receive prescriptions on the retail side. They also can choose to get a 90-day supply at a CVS pharmacy or other pharmacies that participate in that program with us without having to go through mail order. So individual and family plans are changes. Again, mail order copays, again, were reduced from 3 times to 2.5 times. HHS, another little change is they've limited the number of plans that a carrier can offer within the gold, silver, and bronze metal levels that are non-standard plans. So you'll see, excuse me, some of the plans that we had to eliminate are because we were very heavy on the brown side and very heavy on the silver side. So again, they're trying to make sure things are kind of even amongst the carriers on the number of plans. And ambulance coinsurance, we've increased the coinsurance to match inpatient coinsurance if it didn't already match on that plan. Of course, all of our plans continue to include our foundational offerings. We're including engagement 45. Last year was engagement 25. So as long as members, whether it's routine male or routine female, as long as they're getting that adult wellness visit within the first 180 days of their plan year, they are eligible for a virtual gift card in the amount of $45. Those virtual gift cards, again, can be MasterCard, Amazon, Target, Uber, TJ Maxx, Home Depot, Gap Options, or the Apple Store. If someone wants a physical plastic gift card, that is accommodating, but they're not going to get $45 because we have to mail that out and there is an exchange to get it into a card. So we highly recommend them getting the virtual gift card. It is emailed directly to their mailbox and it doesn't ever expire. So they need to get the exam, get the gift card, and then have it redeemed and sent to themselves. So our foundational programs, these are all the things like Sydney Health, like 24/7 Nurse Line. There's a number of different programs we've just changed the name on, like our commercial outbound calling is now referred to as our Healthy Life campaign. Again, a little bit easier maybe for members to figure out what the program is. My Health Check-in is actually the health risk assessment versus member profile health assessment. It's new. They can complete it in less than 8 minutes. Very, very easy. A lot of people like doing that. More importantly, our cancer care navigators, again, these are folks that are going to help our high-risk cancer patients with critical support, not only in obtaining their cancer-related care, but also making sure they've got access to any emotional or physical health care needs, and to make sure that they are put in connection with any other community resources that those members may need. The other expansion that we've made is on our back and joint pain. As we all know, that can be very debilitating. There could be surgeries involved. Unfortunately, a lot of times there's a lot of medications that can be prescribed for people. So the back and joint enhancement offers them personalized, non-surgical pain relief solutions. So it is an online program, but it helps members really drill down to the root cause of the pain. And it helps us identify which members are at risk and really allows for us to target those members to get them hopefully engaged in this particular program. Again, it really helps them understand the benefits of daily exercise and education, hopefully to eliminate some of their prescription needs and ultimately to cut down on potential back or spine surgery. Again, smart rewards, we already talked a little bit about. Again, increasing it to $45. So this would be for any member over the, any enrolled member over the age of 18 and their spouse or domestic partner. Each one of them can earn $45 if they get that wellness visit. So again, we will continue to use our Pathway HMO, which is what we refer to the network for our off-exchange products, as well as our Pathway X HMO network, which is what we refer to as our on-exchange network. The networks are the same, whether it's on or off. We will offer 14 total plans, 4 bronze, 4 silver, 2 silver that are available off exchange only, and of course 1 catastrophic plan that's available for members 30 years of age or younger. We will offer 3 standard plans, 1 bronze, 1 silver, 1 gold. All of the plans will use the RX Choice tiered network pharmacy, other than the standard, and they will use the base network. Select 4-tiered formulary. All of them have optional home delivery, and they all have the foundational and engagement 45 incentives. So plan specific updates. Of course, some of the plan options, you'll see increases in the out-of-pocket or deductible and out-of-pocket combined. And this is just a sample of some of the changes that we made and where we made them. There are no new plans for 2024, but we have enhanced 2 of our offerings. 1 bronze plan and 1 silver plan will have duplicate offerings, one without embedded adult dental and vision, and the same exact plan that includes embedded adult dental and vision. Here's what that embedded adult dental and vision looks like. So the dental has no deductible, no waiting period, $1,000 annual max. The kind of embedded premium on that is lower overall than what you would buy a similar product standalone from us on. Of course, the vision is $20 copay for the exam and lens every other year, $130 frame allowance or $80 allowance for contact lenses in lieu of frames and lenses. And of course, non-elective contacts are always covered at a $0 copay. What's important about this adult is there's no deductible prior to dental benefits, where there is on the pediatric dental. So pediatric dental is always after the medical deductible has been satisfied.
Dang, this is really important to pay attention to what Nancy's going to say right now. So
yeah, the plans that we had to discontinue, again, HHS is limiting the carriers to the number of plans. So that was the biggest part. So, or it could have been, we just changed, again, deductibles or out-of-pockets or a combination of the 2. So these are the 2023 plans that are being discontinued and what the 2024 mapped plans for those old plans are going to look like. And again, you'll be able to view this recording again to see this, or of course you can take a quick picture of this screen as well. So what the product summary for 2024 looks like. So here's the name of the plans. As you can see, we still have a number of bronze plans and silver plans that we offer, as well as a one gold plan and 1 catastrophic plan. One of the things that Brad asked to identify for you guys, just maybe to give you a starting point, is what our most popular selling plans were for 2023 by enrollment. So hands down, our most popular selling 2023 plan was the Anthem Silver Pathway X HMO, $5,800 deductible, 40% standard. So that's one of the new standard plans. And what the 2024 option is going to look like is the same plan with a small increase in deductible. So these just go line by line in order of the enrollment that we've got. Number 1, number 2, number 3, number 4, number 5. Of course, you should always enroll the member in the plan that suits their needs the best. Not everybody wants to be enrolled in an HSA, but some people certainly do. And here's the most popular selling plans, again, by enrollment. So health savings accounts, again, as an option, we provide members with the opportunity to set up integrated banking with Anthem through our banking facilitator. Once their plan is in place, they can contact customer service and set up this HSA account. It's optional. So if they would prefer to use a local bank to set up an HSA qualified account, they can certainly do that. Again, just like any other HSA banking account, they have to go through the Patriot identification process with the bank in order to have that account fully set up. And with that, I will turn it over to Kathy Shiplett.
All right, thanks, Nancy. Give us just a minute while we switch over presenters so I'm able to move my screen along here. And get the display settings set up properly. Okay.
Looks great. Looks great.
How about that? We're like old hat at this, aren't we, Jeff?
Hey, you bet, Kathy.
Okay, I want to start out by talking about Anthem Enhanced Choice. This is our medically underwritten health plan that provides coverage for 364 days. That is key in the state of Ohio. Members can apply year-round, not just during open enrollment. And with our short-term plans, pre-existing conditions are covered right from the start for the enrolled members. Quoting for our AEC plans will be open on October 5th, which is in just a couple of days. So a couple of the details on the AEC plans. The effective date is always the 2nd of the month, and that is because it's only 364 days, and we can either chop it off a day, start it a day late, end it a day early. We felt that it was better to start it a day late on the front end, because on the back end, who's going to remember about that 1 day shortage at the end of a year plan? So it's effective on the 2nd of the month. As I mentioned, it's medically underwritten. It can be applied for year round. So currently, the Ohio regulations do allow consumers to buy the short-term plans with durations up to the 364 days, and they can reapply for a new term of 364 days as many times as they want. There's no limit to the amount of times a member can reapply, but they do have to go through medical underwriting and be approved at the end of each term if they want a new term. As many of you may have been following, this is up for discussion about short-term plans, and it could change based upon regulatory updates of the short-term coverage rules, but as of now, this is still the case. So as changes may or may not occur, there may be changes to the short-term plans. That's yet to be seen. So the coverage effective date is determined by the date that we receive the completed application, provided that it is approved for coverage. So if we receive an application between the 1st and the 25th of the month, the effective date will be the 2nd day of that upcoming month. If it is received the 26th through the last day of the month, the effective date will be the 2nd day of the 2nd following month. So confusing language. An example here would be if we received an application on March 25th, The approval will be, that application will be made effective on April 2nd. If it's received on March 26th and approved, the effective date would be May 2nd. So the 25th is the cutoff for that application, if it's approved, to be effective the 1st of that upcoming month, the 2nd of that upcoming month. Again, members do not renew, but they can reapply for a new term. We do offer a total of 8 plans. All of our short-term plans have our Blue Access PPO network. We offer the Select formulary, same as our individual ACA plans, our X-Choice tiered pharmacy network, optional home delivery for prescriptions, and the individual foundational well-being solutions that Nancy had discussed with our individual policies. That applies to the AEC plans as well. We have no changes to our short-term plans for 2024. On your screen right now is an outline of the plans that we have where preventive care coverage is subject to deductible and coinsurance. These plans do not cover the most costly tier medications, tier 3 and tier 4, but they do offer coverage for tiers 1 and 2. Office visits will be covered the first 2 visits with a copay, and after that, office visits will be subject to deductible and coinsurance. This is an outline of our least expensive plan. So the coverage is pared down a little bit so that we're price competitive here. This is ideal for people that are trying to bridge coverage between waiting periods. They know that there's a finite number of days or months that they're going to need this coverage, and they don't need first dollar coverage on all of those items. However, our most popular plans are those that offer preventive care coverage at 100%. We have office visit copays for primary care and specialists, and these 2 plans offer coverage for all 4 tiers of the drugs. So these can be used it's more in line with a full coverage plan that they may be from an employer-sponsored program or an individual program. These can be used for more of the full term or longer term if they're reapplying year after year. So we do have 2 different types of plan designs to be aware of. Those that offer first dollar 100% preventive coverage, the copays for the doctors, the copays for all of the medications. And then we also have those that have that pared down a little bit for least expensive coverage options. We will be mailing letters to anybody who is on a current Anthem Enhanced Choice plan, just notifying them of the open enrollment dates for ACA plans. This is 11/1 to 1/15. And the reason that we do this is because the end of a short-term plan does not create a special enrollment plan. It does not create the ability for them to select an ACA plan when their short-term coverage ends. So we're mailing these out to members, just making sure that they are aware if they need a longer-term program where possibly they don't have to re-enroll, they don't have to qualify for medical approval at the end of this period. We're letting them know that there is an open enrollment period so that they can flip over. Next, let's talk about the network updates, and this is specific to ACA. We are talking about our Pathway HMO network for our ACA plans. We continue to participate in all 88 counties in the state of Ohio. And anytime you mention Anthem and network, what has been top of mind in conversations for the last several months has been Mercy. And Mercy did sign a multi-year deal with Anthem, taking us through September of 2028. So even though it only applied to Medicare and Medicaid, the terminations with Mercy, They have extended not only Medicare and Medicaid, but they also extended the commercial business through September of 2028. So if you had not heard, I think this deal was completed last week. Mercy is continuing to be in network for commercial, Medicare, Medicaid for our Anthem members.
That's
With our
fantastic
ACA
news, Kathy.
I'm
That's
sorry?
really fantastic. Yeah, that's fantastic news. As a guy who went through that in my former life, I know how trying it is for you, the carrier reps, but also the brokers, because they get constantly calls by their clients. So that's good news for Anthem. I'm really happy about that.
Right, yes. So in Dayton, we have, and this is not an all-inclusive list by any means. This is just pointing out the biggest provider networks in these areas. In Dayton, we have Kettering Health and Premier Health, but I do want to point out that Kettering Health is up for renewal of January 2024. So we are currently in discussions with Kettering Health Network. In Columbus, we have Mount Carmel Health Systems and Ohio Health. Ohio Health was a big win that we were able to add last year. They continue to be in our network. However, Mount Carmel Health System is up for renewal also, January of 24, and we do expect Mount Carmel to leave the network at that time. So Columbus will continue to have Ohio Health. In Cleveland, we have Metro Health and St. Vincent Charity Medical Center. Cincinnati, we have Christ Hospital and UC Health, as well as Tri-Health. And Youngstown, we have Mercy and Steward Health Systems. Out of network, we also contract with King's Daughters in the state of Kentucky. With Anthem Specialty, our plans are very strong and robust. They can go toe-to-toe with any of the standalone carriers for specialty. We have broad network access, deep discounts, and meaningful product features. Our products on the individual side, for dental, we use the Prime network, Dental Prime, and for the vision, it is the Blue View Vision network. Anthem specialty benefits are integrated with our medical plans, and this allows for low patient data to be connected between the different providers, delivering better health outcomes and also lower costs. Some of the updates we're going to be covering for specialty, we have new dental enhancements, including dentures at home. We also have ortho at home and new vision discounts on prescription eye drops. So let's take a look at those enhancements. First, we talk all the time, and Nancy had talked a little bit about our Sydney Health app, where this is a key and it plays a very vital role in our members' access to care and understanding their benefits. And it doesn't stop with just the medical. This app also connects members to their dental and vision benefits. We have Express Exams that offers an online vision exam in 10 minutes or less, but this is for contact prescription renewals only. So it is reviewed by a board certified doctor and available 24/7 with no trips to the optometrist. When a member just needs a refill script for their contact lenses, they can get their vision exams done online. Dental at Home provides virtual urgent care and problem-focused exams available 24/7 with a teledentist. Ortho at Home offers teeth straightening with clear aligners in the convenience of your home without having to go to a dental office. And members get network discounts with the Smile Direct Club and Bite. And new in 2024, we are now offering dentures at home. This is for replacement dentures only. So it is not for first-time denture fittings, but this is a custom fit premium replacement denture done at home. And members can get up to a 60% savings versus traditional dentures that are done in the office. No visits to a dental office are required this way. The dentures are digitally milled from a polychromatic material for superior strength, bacteria resistance, and the translucency of natural teeth and gums. It includes oversight from a licensed dentist, guaranteed fit, lifetime replacement warranty. Dentures at Home provide a lifetime digital file for easy denture replacement, 30-day money-back guarantee, special lifetime warranty, and financing is available as well. So what this would look like to a member, this slide takes us through the member experience. They will answer some questions. They will have their dental plan coverage validated and set up payment options. Then they send in their current dentures in a supplied prepaid overnight box. The dentures are scanned and returned to that member within 48 hours. And their new dentures will arrive to them within 2 weeks, guaranteed time frame. We have also added discounts on prescription eye drops, specifically atropine and total tears. These are used to treat myopia and dry eye. And this is through Imprism RX, mail order only. So the discount applies when a Blue View Vision member sees an in-network provider and they submit the prescription through the Imprism RX only. And there's an average of a 30% discount on these products. So atropine is made to treat myopia, which is also known as nearsightedness. And you know, we think of this as a very common issue with people's eyes. Many people, there's 19 million people that have vision impairment in the United States. But myopia has been identified as an upcoming epidemic because it can lead to retinal detachment, cataracts, glaucoma, and even blindness. So doctors now have new tools and strategies to manage the possible progression of myopia in suitable patients. But many people are not aware of the dangers of the advanced myopia or that treatment management options are available to change the rate of that progression. So that's the importance of these new eye drops. This is something new that's out on the market that can help to treat this condition to keep it from going into something more severe. And the treatment of dry eye, this is a condition that about 16 million Americans currently have. It's a condition that can be controlled, but does not go away. And this can lead to eye infections, damage to the eye surface, and ulcers. So if it's left untreated, it can lead to permanent eye damage while reducing, obviously, the quality of a person's life. And the cost of the prescriptions have historically been cost prohibitive. So we are trying to do what we can to offer discounts on these eye drops to make it more accessible to more patients. Next, just to touch on commissions and bonuses. There has not been any change to our commission structure. Commissions will continue with a per member schedule of $18 per member per month. And this is a maximum of 2 members per policy. That is on our ACA policies. With the short-term plan, the Anthem Enhanced Choice, this is a $270 per member per year commission with a cap of 4 members. And this amount is paid per policy. It doesn't matter if that person stays on the short-term policy for 1 month or the full 364 days. That is a one-time commission amount that is paid to the broker. There's no change, again, to the grandmother-grandfathered policies with the commissions. Next, I want to touch on understanding Medicaid renewals. As our state unwinds from the pandemic's hold on the Medicaid redeterminations, there are a lot of members out there who could really use some guidance. This is very confusing, as all insurance is. They are understandably nervous about losing their coverage and are looking to people to help them understand their options. We are trying to make it easy for you to get all of the background and resources, latest information that you need to guide these members and to the best plan options for them. You can click on the dedicated tab on our anthembrokerhub.com. This is titled Medicaid Renewal. The most important message that we all have a part in playing and getting out to the market is that if a Medicaid member receives a letter asking them to requalify, they have to respond. If they do not respond, then that means they are going to get their coverage canceled regardless. So it's really important that they know they have to follow through on this. We also have a site, anthem.com/stay covered. This is our online destination for Medicaid renewal education and resources. And we also want you to know that Anthem continues to invest in search engine optimization to ensure anthem.com/stay covered is visible to consumers searching for information by elevating our content to the top of the search engines. MyHealthBenefitFinder.com is a decision support tool that provides personalized benefit insights. And this will help members and consumers to either re-enroll in Medicaid or find and enroll in other health plan options. And this tool goes beyond just insurance, and it also identifies public programs such as food, transportation, child care benefits that consumers may be eligible for. So this is a differentiator with Elevance Health in the market, as other industry tools don't provide this level of support to the impacted consumers. It also helps align with our mission of improving the health and humanity, going well beyond selling just insurance. Next, I just want to touch briefly on GeoBlue. I know we're coming up on the end of our time here together. GeoBlue is the travel insurance of Anthem Blue Cross and Blue Shield. So any vacation travelers to expats, do not let your clients leave the country without this. It has first dollar coverage for anyone traveling outside of the country. And this is not just for your clients that have Anthem coverage. This is for any coverage. This can be added for those traveling outside of the United States or living outside of the United States. And as a reminder, with Medicare policies, there is a limit of $50,000 per lifetime. So this is a really important piece to have for seniors to cover their health while they're outside of the United States. There's a link on this page that will take you to the GeoBlue website, where you can easily get appointed and access plan information, run quotes to send to your clients. And please reach out to your broker advisor if you have any questions and would like any additional training on GeoBlue. In the appendix that will be available, we will be providing this presentation. And at the end of the presentation is an appendix that will include information on the changes in deductibles and out-of-pocket limits, how to access virtual care, how to access prescription drug lists, formularies, and also the AOR process for individual policies. So that is the end of our presentation today. We really appreciate you taking this time to share with us and hope you found this beneficial.
That's awesome, Kathy and Nancy. What a great pace. Great enough that I could still take more notes from hearing the presentation last week. So thank you for that. There's a couple of questions I want to answer, and if anybody wants to stay on, where we can unmute you and you can ask your question directly to the ladies. But a couple comments I had regarding the Medicaid redetermination. What we've been hearing from some carriers is it's not as big as everyone first expected. Many of them are getting getting back on Medicaid or qualifying for Medicaid. That's at least so far. We know we have many more months to go ahead of this. So, just stay focused. You know who your clients are. Be sure to, outreach to them, because pretty much know their situation and where they may be affected. Lastly, I wanted to say something about GeoBlue. You all know that my past history is in Medicare. And on that $50,000, I just want to remind everybody, if you don't know it already, that $50,000 is all via reimbursement. So if your friend or your clients are out of the country, they're going to have to lay down a credit card to make that payment and then get reimbursed later. Most important thing about GeoBlue, and I used it when I took my nephew to England with me, it was inexpensive, even for me at my semi-advanced age 5 years ago. But one of the biggest things that international travel policies work for is extrication from that country. I had an agent who had a client in India who shouldn't have really gone to India for a 3-month period, but she ended up being in the hospital for about a month and also was in skilled nursing for a month. And she wanted to come home, but no airline would let her, and they thought that Medicare should have covered it. The problem, and my wife, the flight attendant, just validated last week when she overheard this conversation between us, is that they can't take on any more oxygen than they already do, right? Which drops down from the masks, but they also carry a whole load of oxygen in the cargo belly of airplanes, especially when they're flying over the North Pole. In case they were to have to make an emergency landing, there would be oxygen. So really interesting points I wanted you all to know. So that was my addition. Jeff, did you have anything else to add? And then we'll get to these couple of questions.
No, let's fire away into some questions.
Yep. So Steve Truman asked, do you expect short-term plan changes to be announced by CMS for 2024? I'm going to let you answer it. I want to answer it, but I'm going to let either of you answer it.
I can jump in here. We're just waiting, as everyone is, to find out what is going to happen and when that will take effect. So certainly there has to be some leeway. We expect that existing plans will be grandmothered in, but the regulations have yet to be released. If there will be changes, we will all find out together at that time.
Great. And I mean, so if you didn't catch what Kathy said, is those plans aren't going away yet or being adapted yet. So the big opportunity, and I think I hate to use this expression, but the bum rush to get to a lot of clients who short-term applies to is between now and that effective date, which might be December 1st. Is that correct, Kathy? If it goes into effect, or is it going to be 1/1?
Well, that's another $1 million question. Again,
See,
the
there you go.
government, once they come out with their ruling, it's to take effect 45 or 75 days after that. So
Okay.
it honestly depends how quickly they come out with what it is they're potentially going to change.
Good. So the silver lining in that is you can still write these plans and they are renewable because they're already on the plan. Or if they're not renewables, Nancy, contribute there, but at least they have the plan for the next 364 days from that effective date. Will they be able to renew, Nancy? I can't
No,
remember.
I mean, if the government makes changes, no, they would not be able to renew at the end of their term, is what we're suspecting.
Okay.
But our quoting for January 2nd went live on October 5th. So you can quote January 2024 effective dates. So we believe that any policies that are underwritten, issued, and paid for would be able to continue through the end of their term.
Good. That's excellent. All right.
Still
Next
have a couple of
question.
days before quoting is open on that.
Yeah. So, I mean,
did it not go live?
It's not October 5th yet.
Oh.
You're getting ahead.
Oh,
You're right.
wow. So if you guys can hold your horses for another 2 days, then you'll be able to do that. But the important thing is you've got at least the next 58 days to go ahead and find somebody a policy that you know is kind of on the fence. So that's really a good thing to do. And then the next question is from Jill, and she's asking if somebody is in the middle of their current short-term policy, can they reapply for a new one with a January 2nd effective date so it terminates in line with the individual open enrollment period? Or I'm going to let you see if Brad answers this correctly. Is there any chance to rewrite them before January 1st so that the change would not be effective? So go, ladies. That was me adding. So I added after she said individual open enrollment. Am I right or wrong?
I mean, you can reapply before the end of the term. If you want a January 2nd effective date, I have a number of brokers do that just to get their members in sync with ACA policies, since lapsing a short-term policy is not an SEP as it stands today, to get a guarantee issue ACA plan. So yes, you should be able to do that.
So should they call in and term their current policy, let's say 12/1, and then apply
Well, I
for
wouldn't term
12/2?
anything.
Okay, they don't need to term it.
Anything until you've got the answer on the new policy.
Yeah, good. All right, so those are the only questions typed in, but anybody that's still on and wants to ask Nancy or Kathy any additional questions, just go ahead and raise your hand. There's a little button that you should see. Raise your hand and I'll unmute you and you can fire away. I'm seeing a lot of people jumping off, so maybe not. I really appreciate everybody staying on an extra 8 minutes. But those 2 questions were really important because I guess everybody stayed on until those got answered. But for those of the 15 of you still on, just ask away, or I may unmute all so that it wouldn't let me do it. Maybe now. Nothing. Got it. Let me unmute Jagged. Jagged has Jagged, you should be able to get your question answered now. And then Jill has another question.
Thanks, guys. Are you going to, any slides for this going to be sent to us, please?
Cornerstone is going to have the recorded version of this presentation along with the slide deck posted to Cornerstone's broker portal, I would imagine within the next couple of days.
Okay.
Yeah, maybe even before the end of the day.
Yeah.
And actually, we'll probably send notification of that out there because I always get them.
All right. Thank you. Appreciate that.
You're welcome. All right. Where did she go? Oh, you're up, Jill. I made you a presenter. That was the easiest way, or a panelist. Hello, Jill.
I think she left.
Okay. Maybe that answered her question.
Yeah. I mean, her question, I can read it. If someone is in the middle of a current short-term.
We already answered that.
Okay.
But she had raised her hand successively. So.
Yeah. Okay.
And let's see, Gary Albert has a question too. So let me unmute him. So Gary, go ahead and ask your question. Okay. You might just have to unmute yourself. You might have been double muted.
I don't see him on the call.
He moved over to staff because I am having a hard time
I gotcha.
unmuting people. So
No, I can unmute him.
Gary. If you can't talk, then just go ahead and type in your question real quick, but you should as you're a panelist. All right, Gary, you should be able to talk now. Or forever hold your peace. Maybe that was something that was latent. That might have been latent.
Self-mute. I think he's on mute.
Yeah,
I think he's on mute.
yeah. Well, Gary, if you don't, if you can't get on, you know how to reach Jeff and I, and we'll get it answered via Nancy or Kathy for you. So I think that is it. Nancy, Kathy, awesome job. Really a great training. So thanks for being an amazing partner.
Thank you, guys.
Oh, Gary, are you on now?
That was Jagged.
Oh, that was Jagged. Okay, great.
Uh-huh.
Thanks. You're welcome, Jagged. Yeah. All right. I'm going to stop recording.